I've got a gentleman that's in the middle of nowhere, unsure if he's potentially lost consciousness. We're working off of Eastings and Northings at the moment.
What happens if you have a medical emergency in one of the most remote parts of Europe?
Ambulance service, whereabouts in Scotland is the emergency?
Stolen White's potentially severed his arm.
Glencoe Mountain Resort Ski Centre.
There's blood pouring out a mouth.
It's in the middle of a field at Loch Ness.
The challenges we've got in Scotland are unique. It's a massive landmass to cover. Finding trauma patients is like trying to find a needle in a haystack.
There's no nearby road. It's not vehicular accessible.
A pioneering new service, the Scottish Trauma Network, is rising to the challenge.
He's a confirmed head injury with loss of consciousness. We're looking for patients who have sustained trauma, who are seriously unwell.
End call.
Emergency call, trauma team by road.
I'm going to task you by air.
Bringing the hospital to the hillside.
We are on scene attempting a land-on, over.
It's almost like the patient is coming to a hospital, but it's just a small square on a hillside.
It's amazing what they can do in the middle of a field.
We'll see the decisions that are made by this elite network of clinicians,
Push him on.
expert call handlers, and specialist lifesavers,
Ready, brace, move.
combined under one new super service.
The patients are being brought to the hospital having had these extraordinary treatments delivered in the field, did not previously survive.
We're on the rooftop of the Queen Elizabeth Hospital in Glasgow.
Now we are going to see survivors.
Quad bike is definitely an adrenaline rush. It's really exciting, but it's also nerve-wracking at the same time, especially when you first start because there's so much power behind it. I was definitely nervous about going on the bike by myself, so I felt a lot more comfortable with my uncle Robert in the driver's seat. I just remember hitting lots of bumps, and I remember my uncle not being able to get control of the bike, and it was at that point that I thought to myself, you know, we're losing control of this. Because of the way the bike had landed, it trapped my legs at the back, and my uncle's full body had been trapped under the front of it. So trying to lift the bike off of me was putting pressure onto his injuries. And once I wasn't trapped, the first thing I done was sit up. My uncle was like completely lying flat, and the first thing he said was, "I can't breathe."
Oh man, it's like 7 calls coming in. Which one do you listen to? 5, 3, 4, what's this?
Do not move him unless he's in danger and do not split any injuries. When did this happen?
Just now, look. You're in 5, 3, 4, aren't you? Yeah, I'm listening to it.
About 50 miles an hour.
Right, okay.
So it's come off at about 50 miles an hour.
30 miles south of Glasgow, at an off-road racetrack near Drumclog in South Lanarkshire, 40-year-old Robert has been crushed by an overturned quad bike.
It was a big heavy vehicle, about a ton and a half.
Right, so this quad bike was about a ton and a half.
Yeah.
And it landed on his chest.
Yeah.
Right, we're going to get some help for you now, sir, okay? Is that him speaking to you? Is there any serious bleeding?
I can feel my sleeves soaking,
Right,
my chest is
right.
soaking.
Okay.
Something's sticking out my
Right.
chest.
What's sticking out of his chest?
You don't know, it's on my tongue going. I can feel it.
Okay.
And someone says that they've got something sticking out of their chest. Have they got a penetrating wound, or is it that they've broken their ribs? And if that rib fracture has punctured the lung or has damaged the heart, then it can obviously be a very serious injury.
What the hell?
Right, we're getting some help for you now, sir, okay? Just try and keep calm, okay?
Listening on a call and you hear somebody screaming in pain, I can think, oh my God, I just hope we get to that guy as quickly as we can.
Dan, it's Stephen. We've got an emergency call for you by road, please.
With no helicopter available, the Glasgow-based trauma team, including emergency medicine registrar Dan Burley, is tasked by road to the scene. 2 ambulances are also dispatched.
Hello, Ben speaking.
Hi Ben, it's Dan.
You alright, mate? How you doing?
ETA is probably 1750.
1750 ETA. We're just trying to get an exact location.
By road, the trauma team are 45 minutes from the off-road track. But the circuit is vast, spread across 1,200 acres, and Robert's exact location is still unknown.
We have got a lot of responses coming to this, okay, but we need to just actually pinpoint exactly where you are. You search for compass on your phone, it'll have a latitude and a longitude of your position.
There we go.
What have you got?
0.5.
So, this is an American lat along.
Can we not do anything with that?
So I don't know.
We don't have the exact location of where Robert was trapped. And with things like quad bikes, you're away from the road, so you could be 5-6 miles off road. It makes it very difficult for us to find that person.
Can you send that your ambulance? No ambulance, but we'll get where we are.
They're going to struggle to get to scene, is my concern at the moment.
I am going to ask for sort as well, because
Yeah.
I'm 1.5 miles off. Lauren, could you ask Lanarkshire if we could get sort to go to 534?
Scotland's Special Operations Response Team, or SORT, assist complex jobs. The SORT team carries specialist equipment like off-road vehicles, the Polaris and the Wolverine, used to retrieve patients from difficult terrain.
It can go through water, it can go up high inclines, it can follow paths that have not got pavements. It's one of those vehicles that can get to places that a lot of the times we just can't get to by any other vehicle means.
Right, I've found exactly where that guy is.
They're a long way from the road.
So it's still going to be pretty difficult getting them out from rough-looking ground.
If Robert doesn't get rapid medical intervention, he could well deteriorate because he starts to get cold. So if he is bleeding internally, he's not going to clot properly. He could die from those injuries before help gets to him.
When he first passed out, I automatically started crying, you know. I was like, that's me, like I've just watched my uncle die right in front of my eyes.
3253, this says trauma desk receiving, over.
Every day across Scotland, more than 2,500 999 calls are made.
Is anyone trapped? Is there any serious bleeding?
At the trauma desk in Glasgow, trained clinicians listen in to the most critical calls.
Requesting your assistance from male, fallen from a horse with a head injury.
They can task elite medical teams to assist.
A male who had an electric saw and it slipped out his hand and cut the top of his leg.
Ambulance emergency.
We just need somebody here quickly. It's quite a bad accident.
Tell me exactly what's happened.
2 cars I think have collided. 1 car that's gone through a fence.
Do you know the location?
It's a country road. It's about 2 miles outside Berlin. There's petrol leaking and there's quite a lot of debris all over the road.
And is anyone trapped?
Yes, there's an elderly lady trapped in her car at the moment.
Okay, is the patient breathing?
She's breathing, she's dipping in and out of consciousness.
Okay.
The lady's called Hazel.
We've got a 2-car and RTC, 1 elderly female trapped in Ellen. Nearest crew is 8 minutes out.
A nearby ambulance has been sent to the scene, 16 miles north of Aberdeen, where 80-year-old Hazel, a local farmer, is trapped following a road accident.
David, was it an RTC? Yeah.
At the major trauma centre at Aberdeen's Royal Infirmary, a trauma team assembles to prepare for the arrival of farmer Hazel, the elderly driver.
Have they phoned you about this trauma case coming in, date of birth on? It's in December 1940, so she'll be 80. In Scotland, the commonest cause of major trauma is road traffic accidents. For years, it was young people who were having the accidents. Now, we've got more elderly people driving. Driver, RTC, they're here. Okay. Is this Hazel? Yes. Cute.
Right, my love. Just to remind you not to move, okay? Lovely.
Just happened out of the blue. The house phone rang. The ambulance person said, your mother's been in an accident.
Is it sore when I press there?
The junction where she had her accident, it's a bad junction. She was always so careful, that didn't really go fast. There was 4 police cars, a fire engine, a scene of carnage, and the car was in the middle of the road, spun round. When we saw all that, I was beginning to wonder, well, how could she be okay?
Elderly patients are involved in major trauma. Let's face it, they've got a greater chance of dying in general just because of their increased age. So we have to be on the ball, making sure that we don't miss anything when they come in.
In South Lanarkshire, the trauma team have arrived at the off-road racetrack, where a quad bike has overturned, crushing 40-year-old Robert.
When we arrived on scene, we were essentially in a really muddy, boggy field. Our response vehicle was not going to manage the difficulties of the terrain, so one of the course organisers was able to give us a 4x4 and take us to the incident site. Moving towards Robert, we were concerned about whether he had a major chest injury with possibly an object impaling him, whether he was bleeding, and also he was cold and hypothermic.
Right, so the SWAT team leader's there, but the Wolverine isn't there just yet.
And the team are on scene with...
Yes.
Lovely. Did they give you any insight into patient condition?
No, they're just there.
Bystanders have pulled the vehicle off Robert, who was trapped underneath.
Is that how when you cough, mate? Yeah, move them up. Can you hear all right, yeah?
Robert was awake and alert, but in a significant amount of pain. Couldn't feel anything sticking out of his chest or out of his skin. So we gave a combination of morphine and ketamine to him.
All right, going to give you some strong painkiller. And we're going to... You don't move, no, you just relax, mate. Try and think of somewhere you were having fun, right?
It all happened so quickly that I didn't really have a chance to process what I was thinking. I just remember the panic.
She's got pain in her elbow, pain in her head, didn't wear a helmet, we've lost consciousness.
So my injuries were very superficial, you know. The first thing that my uncle said was, well, he asked me if I was okay, which, you know, that's what uncles do.
You'll be right, mate. We'll take good care of you.
I was definitely frightened for my uncle because he kept telling me that he couldn't breathe. He was just in so much pain, you know, the screams and stuff, it was horrible.
Does that wrist feel okay? This one? Still up there? Still up there, okay.
Oh my God. Robert's injury pattern was severe. He had suspected chest injuries, rib fractures, possible damage to a lung underneath, and he had a deformity because of a broken bone in his left arm.
Next thing we're going to do, Paul, is we're going to try and reduce that arm fracture.
Yeah.
Sort of straight. Hold on, mate.
How's that stuff making you feel, Robert?
We were very keen to return Robert's arm to a more normal position in order to reduce any pressure on nerves or blood vessels.
There's no pain in there.
And also to stop the ends of the bone moving around, which were causing ongoing tissue damage and ongoing pain for Robert.
Hey, you're going to get this arm fixed.
To get Robert to the waiting ambulances more than a mile away off-road, the Special Operations Response Team have brought their all-terrain vehicle.
And lift.
Oh!
Tactical shot. There we go.
Stop.
I'll try, yeah. You're not going to go.
SORT team bringing the vehicle was critical because it enabled us to move Robert as quickly and as safely as possible over really difficult terrain. And therefore I could make sure that his injuries were protected, his pain was managed, and if there was any deterioration in his condition, it would be recognised early and I could deliver the interventions that were required.
Where's he going to go, do you know?
QE in Glasgow.
QE?
Yeah. Ready, steady, lift.
Robert's journey doesn't just stop once he's on a stretcher out of the ditch. There's still a risk to Robert that he's having ongoing bleeding into his chest. So it's critical that we move as quickly as we can to the major trauma centre.
Are you saying no? You've got a blanket on. I'm naked. Aye. Well, you've got a blanket.
All right, I'm so sorry, pal. Hey, don't you worry. No. Nothing to apologise for.
Where am I going? You're going to the QE.
Naomi. The first time I saw Robert after the accident, he was in the ambulance. He was connected to a lot of machines, and I did realise that it was obviously going to be life-changing.
The team have done a sedation for multiple fractures, has been taken by road to the Queen Elizabeth Hospital in Glasgow, which is the local major trauma centre. He's got multiple injuries that are going to need specialist management.
Hi Ben, it's Dan.
You alright, mate? How you doing?
Long day, on overtime.
So tell me about your job, mate.
The chap pulled over on the quad bike at some speed. Sounds like the quad bike has been rolled over both of them.
Yeah.
I wonder, Ben, was it your call to get the Polaris out with sort of?
Yeah.
Yeah, perfect. Like, that couldn't have been better.
Quite fortunate. You've been fortunate, aye.
Wow! Mate, I'm just going to go and listen to a call.
Okay, well,
cheers, pal. Bye.
Hi Hazel, my name's Emma. I'm one of the nurses. Nice to meet you. You're all right, darling. Don't apologise.
Are you sore anywhere in particular at the moment?
Just the head.
The head and the back?
Okay.
80-year-old farmer Hazel has been brought to the major trauma centre in Aberdeen after being trapped in her car following a major road accident.
The problem here is that we don't have any objective accounts of what's happened. Really, we've got to get all the history more or less from her for the accident, and she can't really tell us anything.
What we're going to do is roll you round onto your right-hand side. Doctor's going to have a wee feel down your spine. Well done.
That's
something sore there?
Further down.
Further down? Yeah, okay,
there.
lower lumbar.
Okay.
She's got some pain in her back, so we're concerned that she may have a fracture of her spine.
Well done.
You're okay,
Good stuff. Excellent job.
She's complaining and has a very swollen right hand, which we think is probably broken.
Well, the hand's really bad.
But what we need to do is exclude life-threatening injury. Just a hint of anything, we're going to go hunting for it.
Okay, we can go to scan.
Scan?
Yep. There's now a term called silver trauma. which is the fact that we are seeing a larger number of elderly people in their 70s, 80s and 90s. They've got a different physiology from us because as they get older, their blood pressure is higher, the blood vessels are less elastic, so they don't compensate for injury or bleeding as well. So that complicates things. It might be easy to miss injuries. So a lower volume of trauma could cause a more significant injury. So see what the CT scan comes back with.
I was just nearly home.
You were just nearly home.
And you can't really remember what happened?
I just remember getting this awful bump in the back.
Oh.
The scan's back. There's a single rib fracture on the right-hand side. So really we're not finding anything significantly wrong with her in terms of her torso. Really now, her hand is our main problem. Let's give her some fluid, half a litre of...
Now, have you ever had an ECG done before?
Yes.
You have? Excuse my hands.
My tummy.
Are you hungry?
Not really.
No? What's your favourite dinner?
Something with chips.
Oh, I love chips. You can't have a dinner without chips.
No.
Are you a good cook?
Not too bad.
Oh, that means you're good. You're being modest.
Well, I had 3 sons, so...
3 growing loons.
She was fairly active up until recently, I would say. She is very hard working. My father and mother have always lived on the farm. We don't know anything else, really.
We got married in 1964. I just made up my mind I wanted to marry a farmer. I went to the Douglas Hotel in Aberdeen. That was a place to go if you wanted to meet a farmer. He could be quite naughty when he wanted to be, and you always knew by the way he wore his cap, you know, when it was on. You could tell what kind of humour he was in.
Would you like a wee drink of water?
Yes.
Yeah.
The first clue we got was when I got him to go and get his eyes tested. And the optician wasn't happy. She'd phoned our doctor. They gave him a scan and x-rays and that. And it came back that he definitely had cancer. They told Alfie he would have about 3 years, but they didn't tell me, or well, he didn't tell me. And that's just exactly what he did get, is the 3 years.
And after that, she was just by herself, basically.
You just feel a bit lost because he's not there anymore.
There you go. Is that the best drink of water you've ever had? Right, so now she's sitting up. We'll just do another check of her blood pressure just to make sure it doesn't take a hit, okay?
Just to be advised, the patient is conscious and breathing over.
At the trauma desk in Glasgow, the team have been monitoring a 999 call from Perth and Kinross.
Looking at the map, either MRT or Coast Guard helicopter, the incline of the slope, it's probably unlikely that our own helicopter would be able to assist.
On Ben Lowers, a mountain above Loch Tay, a solo female hiker has fallen and broken her ankle. Her exact location is unknown, but the terrain makes it inaccessible to vehicles and even the air ambulance.
We'll pass it certainly to the Coast Guard and then we'll see what they can come up with. Is that all right?
Yeah.
So it's going to be Inverness Coast Guard.
Right, no worries, that's great.
Hello, Inverness. Have you got a description?
No, got no description. Don't know what age it is, but she's on her own.
Do you know what's happened to her, or?
No.
Right.
Very little information at all. Just a queer broken ankle,
Yeah.
unable to move. They are saying she is below cloud.
The search and rescue helicopter based here at Inverness can extract casualties from really remote locations in difficult weather. The helicopters can land on islands, can land on beaches, they can winch off mountains, access in the sea, somebody's in the water or a loch.
I feel we've got 1,200 kg sufficient.
It allows us to get to casualties, extract them, and get them to a major trauma centre fairly quickly.
The patient is somewhere on Ben Lawers, the mountain rising over Loch Tay. On board the helicopter are Coast Guard winch paramedics Mark Lean and Josh Williams.
We've been tasked to a walker, possible broken ankle. She's walking by herself, but another walker found her. He's had to leave her position to try and get a phone signal to raise the alarm. Got very little information about her description or her name of the actual injury.
So Tayside have got a mountain rescue team on the hill and are heading towards the location.
Yep, there you go. It's just north of Killen.
Yeah. And
With no accurate coordinates for the woman's location and phone signal disrupted by the surrounding hills, the helicopter crew have no option but to start a visual search.
That's the actual end of the down there. Yeah.
Okay, so she's on a path, I presume.
I'll be cocking the nose off to the left. That'll give me and you better visuals.
When we're looking for people from the search and rescue helicopter, it can be really challenging. We need to make sure that we're all really focused and concentrated on the scene that we're searching to make sure we can give the best chance of spotting the casualty. If a casualty isn't able to move, that patient can suffer the effects of exposure quite quickly, and their injury could get worse, and it could become life-threatening.
Rescue 151, be on scene in 2 minutes, over.
Depending on where she is, if we can actually get in there.
Rescue 151, currently en route to a task in the Killen area.
The Coast Guard have been called to help a fallen solo hiker on Ben Lawers, a mountain above Loch Tay in Perthshire. A local mountain rescue team, including a doctor, is also searching the area on foot.
Okay, we got eyes out on the right. Any visual?
Yes, 1 o'clock, coming into 1:30, sat on the ground.
Oh, visual. Pink high-vis jacket, 3 o'clock, now.
I slipped. The foot was unbelievably painful. The first thought that went through my head was, you idiot. Got my phone out, no reception. My anxiety level was creeping up because you're cold and you're thinking, is anybody going to come? So what I did is drag myself to a vantage point, shouting for help. It must have been 45 minutes after I fell, the dog walker came running over the hill, and he was drenched in sweat. He had to run down to the car and then ring mountain rescue. But then I saw at the far horizon like a really bright light, and I was thinking, oh, that looks like a helicopter. I wonder who they're coming from. Oh, wait, that must be for me.
All call signs, MRT, this is Rescue 151. We are on scene and visual with casualty.
Spotting the patient is just the first challenge. Now you've got to rescue them.
Attempting a land-on, over.
The proposed landing area is a little grassy knoll. It's big enough for us.
We will recce a landing site, what it's surrounded by, what's the slope look like, what's the surface, is it boggy, does it look steep, are there obstructions that could damage the aircraft?
300 metres.
Can you give me tail right 90 degrees? Forward 1 and steady. Can you give me tail right?
And then we'll talk the aircraft down to what's called the low hover.
Nose touching, 1 inch on the starboard.
Another search, and then we will touch down.
Steady.
Good on the left, Chucky.
Thank you.
Thank you.
It's very rewarding once we've spotted somebody that we've been looking for. But immediately you turn your attention towards medically what's wrong with them.
How's it going? What's happened? I think I kind of went down a side of the mountain.
A little grassy slope or rocky?
Yeah.
Rocky.
Muddy. And I just slipped.
How are you on your pain, do you think?
If I'm really not moving, it's about 3 out of 10.
Okay.
If I'm moving, it's a 10 out of 10.
Okay. We're going to need a stretcher for this casualty. She's got a suspected fracture dislocation of her lower leg. We realise that we're going to need to give her some really good quality analgesia. We'll get some pain relief on board straight away. So we're going to give her some morphine. Any allergies or any medication for anything?
I have MS.
MS.
I'm taking MS medication.
MS medication, okay. Multiple sclerosis, MS, is a chronic condition. Your immune system is attacking your nerve endings.
When I was diagnosed with MS, it had a major impact on my life. It wasn't me anymore, and I got fatigued really easily. While being outdoor, you forget about that. It does give me that feeling of there's more to life than just the symptoms. Stood on top of a mountain, you can't see a single soul, and the wind is blowing into your face. And that still proves that I can do it. And you come home and you feel psyched, and it gives you that other aspect to a life that could otherwise just be focused on the condition. But I have to admit that I may have underestimated the concept of walking by yourself in Scotland.
We've got a doctor on scene here and another paramedic. We're just going to correct the ankle before we put it in the splint. If we're treating a fracture dislocation to the ankle, we need to make sure that, if possible, we can get a blood supply back to that foot. If you've got an interruption to the blood supply, the foot or the limb might well be dying, so you need to correct that fairly quickly.
Ready, steady, roll.
40-year-old Robert has been brought to the major trauma centre at the Queen Elizabeth Hospital in Glasgow, having been trapped under a quad bike.
Robert, I'm going to have a look over you, OK?
Robert may have hidden injuries which are not visible with the basic examination.
Where's sore?
My left-hand side,
These hidden injuries are usually related to ongoing bleeding or damage to internal organs that can only be detected with advanced equipment in hospital.
I thought I'd just had that broken arm.
Well, we need to make sure you haven't hurt anywhere else.
It's only once a CT scan has been done that doctors will be able to assess the full extent of Robert's injuries.
As long as I knew that Robert was alive, even if he was left with severe disability or life-changing circumstances, as long as he was alive, there was always the hope that it could get better.
The scanner's come back. You've got some rib fractures on your left-hand side. You've got the broken arm bone on this side, okay? We're also going to put a sling on your left arm. Relax your arm, relax your arm.
There's always a chance with an injury like this that you have delayed healing, damage to muscle, damage to nerve that can take a long time for the patient to regain function.
Is that sore at all?
I think I was most worried about, the fact that he might never be able to use his arm again. And, as someone that owns their own business, and, he wouldn't be able to go out and work, to provide for his family, it was really important. Yeah, that was really quite a daunting thing to think about.
Okay, so I'm going to take your boot off. Yeah. Okay, I'm going to get you to lie down flat, and then I'm going to straighten your leg up, and then pop it into the vacuum splint. Okay? It's going to hurt. We can package it up and it will feel much more comfortable. Okay?
You can lie back if you want.
Yeah, I would have a little lie down. What I'd like you to do is...
To prevent the blood supply to Karen's foot being cut off, the medics need to straighten the displaced bones in her ankle.
It's a really difficult one to do. If you imagine you've got jaggedy bones and then you've got vessels, you suddenly get that wrong, you're going to sever potentially an artery or a vein.
Good, well done. You're doing an amazing job. Nice deep breaths, we're almost done. Taking the interlocks.
Okay, so we're in a slightly better position there. Let's go for a splint there. Okay, how's that pain doing now?
Yeah.
Sorry.
All done. How was that?
Good.
Well done, well done. Super brave.
I have to say that I'm extremely grateful because the foot was unbelievably painful, and I really needed something to alleviate the pain but also straighten the foot for the benefit of faster healing.
What's your pain score like at the moment?
-2.
Pretty happy.
Yes. The actual experience was pleasant. It was amazing. I felt so well looked after.
My intention is going to be get you to land on pretty much next to us. If you do need anything at all, you just need to put your hand up because I'll be sitting right next to you.
Cafe latte?
Cafe latte, yeah?
I didn't realise that was an option.
Yes, very much so.
She struck me as somebody who was definitely seeing the brighter side of life. For somebody who's suffering from a chronic health condition and it's reducing their mobility, I think it's absolutely amazing that they're out in Scottish hills. I think she's exceptionally brave. Nice job, mate. Spot on.
Have you been to Scotland before?
Yeah, I love Scotland.
Was that your first mountain?
Yes.
Oh, honestly, you're hard as nails. We don't get that many customers that are like that, Scottish. So we have a 43-year-old female fallen, injuring her left ankle. Obvious fracture with you in 10:10 minutes.
Yes, that's all received. 9 Wells standing by.
So we're taking it to Dundee, and the hospital's called Nimewells. It's a major trauma centre, so they'll have a good look at the foot.
Portion is now clear. Nice work.
It's really rewarding to know that we've managed to rescue somebody, treat them for their injuries, and take them to the hospital. Ultimately, when that all comes together, yeah, it's immensely satisfying.
So I'll tell you about Hazel here. So Hazel is a lovely 80-year-old lady who still works, believe it or not. She's been driving home from getting some food shopping today when she's been hit by another car. Wonderful. She's some cookie, I tell you.
At the major trauma centre at Aberdeen's Royal Infirmary, the trauma team are concerned about multiple fractures in 80-year-old Hazel's hand following her car crash.
I like your stick, it's very fancy.
So it's come of use lately. Because I broke my leg a while back.
Have you lived alone for a little while?
Over a year. I lost my husband a year ago.
Oh. It'd be a big adjustment living on your own.
It seemed awful queer. I live by myself. I do all my cleaning and cooking and that. But my son Alfred and his wife Cindy do keep an eye on me.
I do worry sometimes about her living alone because she's got osteoporosis as well. So any little fall and that's a hip broken, a leg broken, and that's kind of the end of your mobilities.
Osteoporosis is basically, think of it, it's just your bones get thinner as you get older. You're more prone to fractures.
You bend in the middle and we'll sit you forward. I think you're lying about your age. There's no way you're 80.
Hello. We've had a lady from a road traffic accident that has got a hand injury that I was wanting to have a look at.
Have you had a stookie before?
Well, my leg, I've got 2 pins in my leg.
She's actually got multiple fractures, which is quite unusual. I think that's related to the fact she's had osteoporosis.
So I want you to just try and bend your wrist up.
That way?
That way, yeah, very good. And then bend your fingers down a wee bit.
Yes, that's okay.
Yeah, and we'll tidy this up in a moment.
Hazel's a working woman, so she'll to get back to using her hands, and she's right-handed as well. For elderly people, if they're dependent on a stick, it may actually change their ability to move at all. So it's really important.
Good.
You're going to have significant care until you can regain the use of that. And if you don't regain the use of that, you're going to be in permanent care.
What about walking? Do you need any help when
No,
you're any age?
no, I'm quite agile.
Very good. Okay.
I mean, I can climb over a gate and that kind of thing.
Over a gate? Okay. That's more than agile than most people, isn't it?
When you're dealing with northeast farmers, you've got to have a higher index of suspicion because they play everything down.
Oh, I think if you keep going...
That's the secret, is it?
That's the secret.
Does that mean I'm going to have to work here till I'm 90?
Oh.
The folk who are on farms are incredibly hardy, and they will come in with really horrendous injuries and just say there's hardly anything wrong with them.
And you'll be okay with one arm out of action?
Oh yes,
Yeah.
I'll easy manage.
Are you right-handed?
My parents didn't encourage you to make a fuss about things, you know. If you hurt yourself or that, just grin and bear it.
She doesn't really let nothing stop her doing anything. If she puts her mind to it, she'll go and do it.
You have to keep going or else it's fatal when you sit down. That's what the doctor said when I retired. Do not sit down.
And then I'm just a bit worried because our heart rate's still high, so we've got to think what that is. Certainly wouldn't be sending her home with a high pulse at 110, 120 until we see that resolve. Kakani, as we say in Aberdeen. So.
Worried about her high heart rate and the risk Hazel might deteriorate, the doctors decide to keep her on the ward overnight. It's 12 days since 80-year-old farmer Hazel's car crash. She's come to a clinic at Aberdeen Royal Infirmary to find out if she will need surgery.
I'm trying to use my fingers as much as possible. There's no excuse, you can still use your left hand. I think you have to be dying before you get any sympathy from a farmer.
Look at these bruises. So, your fingers look reasonably straight. But surgically, I can't make that any better.
No.
So you are going to have a little bit of a bump with this finger.
Oh, well, but I mean, I won't worry about that. My mother said I was always a nuisance. I even came at 8 months, Dunkirk. She went into labour because she thought the Germans would be over.
We will keep you in a splint for probably another 3 weeks. Mainly, we want to keep your hand still until those fractures set.
Is that okay? Okay.
Fine and cosy.
Is it? Yeah.
Mrs. Stewart is 80 years old. We know that she has wear and tear in all of her hand joints. This could completely affect her mobility.
Your hands will be in this position
Yes.
for a long time.
She was still driving at the age of 80. She's obviously independent. She's mobile. I suspect she may well go back to driving.
Okay, thank you very much. That was really good. You know, it feels a lot better now because it's stable, and so I have to keep it like that for 3 weeks. And then I'll take it off, see how things are going.
At the Queen Elizabeth Hospital in Glasgow, it's been 7 days since Robert's quad bike accident.
Last thing I remember was just flipping the quad bike and rolling over and landing on top of me. My niece was on the quad as well. Luckily, it missed her and landed on me. The wrist flopped in one direction, the elbow flopped in the other, and they put 2 plates in, 8 screws to hold it together.
When I first seen him and then he asked me if I was okay, it kind of made me laugh a little bit because, you know, he's in much worse condition, he's probably in so much pain, but yet he's not thinking about himself, he was, you know, worried about me. In regards to quad biking, I definitely don't think it's something he's ever going to want to do again.
Since I've returned home, it's been quite difficult. I've got a lot of nerve damage in this arm. I'm a joiner by trade, so my hands and my tools. It's quite difficult to work.
The kids have been great. If Robert has needed something, maybe a cushion to prop his arm up on, and then they'll say, I'm helping Dad because I'm his little helper. So it's really good to see how close they are to Robert.
A serious accident, it puts life into perspective. You have to think if one thing does go wrong, it's just how much you've got to lose.
Well, I'm lucky in a way, and it could have been a lot worse. I think I got off quite lightly, really. The hand is not bad at all. I maybe just haven't quite the same strength in my hand. They've got right sturdy legs, haven't they? I'm not all that fit, But I'm good for plugging a hole so that the sheep don't go where they're not supposed to go. Alfred, because he's here, worries more. He tends to come in every morning to make sure I haven't popped off and I'm still living.
I have to say that the whole experience was a wake-up call. I'm the luckiest person alive. I don't deserve this amount of luck. I'm lucky to be alive, to have been found. Out of nowhere came like loads of people all helping me. I can't wait to get back into Scotland. I wouldn't want to miss it for the world. And I have learned definitely to respect nature more. I know I take a lot from it, but I need to give it some respect.